So, what does an ice storm and a total wipeout of our power grid in northern Michigan have anything to do with acute pain? In this episode, you're going to find out.
Welcome to the Defeating Pain podcast with Dr. Ted Arkfeld. If you're tired of treatments that just don't work, you're in the right place. Each week, we'll talk about new ways to beat chronic pain using at-home therapies. You don't have to go to the doctor to feel better. Let's help you start living pain-free. Now, here's Dr. Arkfeld.
Hi, I'm Dr. Ted Arkfeld, and a few weeks ago, I was leaving for vacation, which always causes me a little anxiety and trepidation because I know what's going to happen. I'm going to have an influx of new patients. In 37 years of practice, it's always happened. Every time I'm going to head out on vacation or go away for the weekend, the day before I leave, the clinic is full of new cases. And that's exactly what happened a few weeks ago. Except this time I had three patients that came in and they all had what I call hot disc and they had sciatica going into their left leg all the way down to the calf muscles. Now, each of them had a little bit different mechanism of injury, but the presenting complaints were still the same. They all had pain that was sharp and they felt unstable and they really had difficulty in moving. And on a scale of 0 to 10, they rated it at a minimum of a 7 and sometimes it spiked up to a 10. So this worries me. Every time I'm going away and this type of scenario happens, I always worry about the patient. But that worry is a little decreased. I don't worry as much because what I did is I prescribed them BioWaveGo is our number one pain defense. I can't prescribe medication as a chiropractor, so this is my number one defense when it comes to pain. Any patient that comes into our office with a pain scale of at least a 5, they're going home with the BioWaveGo unit. And so all three of them were prescribed the units, and I told them I'd see them in a week when I got back. That week turned out to be almost 2 weeks, 2.5 weeks in some clinics. I have two clinics. I have one in Gaylord, Michigan, and one in East Jordan. And while I was gone, northern Michigan got hit with a horrendous ice storm, the likes that I have never seen in my entire life. And when we came back on Sunday a few weeks ago, it was like driving through a war zone. There was trees bent, damaged. There was power lines down. It sounded like gunshots constantly going because the branches were snapping and then crashing and then the icicles hitting the ground. Quite honestly, it was pretty scary. As a matter of fact, our power in our house just came on this past Friday. So I was worried. I was worried about these patients, what was going to happen. And so it was great relief to me when I saw them a week ago Wednesday for the first time in about 10 days. And they said, we actually did pretty good. They still are in pain, but it wasn't anything like when they presented. And they said the BioWave Go is what did it. We don't know what we would have done without it. We probably would have ended up in an emergency room and getting medications, and neither one of them, all three of them, did not want that to happen. So, what the BioWave Go does is when there's injured tissues, they call those nociceptors. That is the receptors in our body that turn bad and they produce pain. And so, what BioWave does is it creates a force field at the site of pain and it blocks those signals from getting into the spinal cord and on up to the brain to where we can perceive the pain. Once it gets up to the brain to perceive the brain goes into protective action. It's sending information down to inhibit muscle movement, to cause spasms, and any little movement will spike in the pain. What this does is it stops that. So by the time I got back, each one of these patients were down to a pain rating of 4. One was still at a 5, but it was every now and again. It was not a constant pain. I was greatly relieved at that. I shouldn't be surprised because it's been going on since 2016 when I brought BioWave into my practice. The least expensive way to do this that you can do at home in the comfort of your home, and you can do it multiple times a day, is BioWaveGo. And you really have only the pain to lose, because if it doesn't work, there's a 30-day money back guarantee. If it doesn't work, you can turn the unit back in and get a full refund. So you really only have the pain to lose. The other thing that I recommended is to get into BrainTap. BrainTap is an entrainment program. It's an app, and you can try it for 15 days at no charge, and it will help get you out of that fight or flight response. So you put the BioWave Go on the area of pain, and then you do BrainTap, and we have had great success with that in the clinic. I'll have links for both so you can get on, and if you're interested, get them both ordered. Okay. That's what's so important, is that you do things outside the office, because I've said in other episodes, patients come in and they are in my office for about 30 minutes, and then I don't see them, for about 48 hours. The most that I will see a patient is 3 times a week. There's a lot of time in between those visits, a lot of time at night that treatment could be occurring. And that's where you can do the home therapy consisting of BioWaveGo and BrainTap. We've just found that combination has been very effective. The final piece of this puzzle is going to be a truly neurological therapy. It's more expensive, but it really helps in building muscle and preventing future occurrences. And that is called ARP neurological therapy. But we'll cover that at a later date. At any rate, let's defeat pain. Let's take it to the woodshed, smack it around, and cause pain to have pain. And, I'll see you in another episode. Okay. Again, the links are down below. Oh, before I forget, I got to do this because every YouTuber does this, right? If you like what you're seeing, if you like what you're hearing, subscribe and tell others. Give me the like button, comment. I want to hear your story. Tell me about your story, and I'll respond. Tell me about your story. Maybe we're going to have to set up a time. I'll get on the phone with you and talk to you about it. But the reason I started the Defeating Pain podcast is to help as many people as possible. And the only way I can do that is for you to know what's going on in the world of pain. And not all your chiropractors, not all the PTs, quite honestly, very few of them know about this wonderful technology that I'm going to be going over in the podcast. So again, if you like it, subscribe it and comment on it. See you in the next one.